I am Jenefer Duane, and I am the Senior Program Analyst for the Office for Older Americans at the Consumer Financial Protection Bureau. And I am here to talk to you again today about Money Smart for Older Adults, only we're going to highlight specifically, or we're going to put a big emphasis, I should say, on COVID-19 frauds and scams and resources that can help you and your residents, and hopefully you as a consumer, as an individual, your residents, of course, and then any, of course, opportunities you have to share around. So I will keep advancing here. The first thing I need to do is just make sure that you know that I am, for all intents and purposes, an individual today. And as an individual, I may express opinions that are not necessarily those of the Bureau, and nothing I say should be construed as legal advice or guidance. So we got that out of the way. If you have any questions about that, send me an email. But I am, even though I am here on government time, I am here speaking individually today. I don't know how many of you, I know some of you are new, as I understand it, perhaps to B'nai B'rith and also perhaps to the work of the CFPB. So this is just a kind of quick and dirty about what you need to know about us as an agency, but basically we're a regulatory agency, a financial institution regulatory agency. We were established under Dodd-Frank in the year 2010, so we're celebrating our 10th birthday. All right, so we're a regulatory agency. We regulate large banks and credit unions over $10 billion in assets, and then a host of other financial services, lenders, etc. So if you want to know more about us, it's consumerfinance.gov. I'll just shoot on forward to, I represent a particular part of this agency, of this bureau. We're called the Office for Older Americans. We're under a division called Consumer Education and Engagement. So we have enforcement and supervision functions. We have rulemaking, regulatory functions. We have, of course, our front office and all our operations functions. But we have this Consumer Education and Engagement division that has several offices within it that address people of different, I guess we kind of use the word vulnerabilities or special populations. Now, let me slide forward. Come on, there we go. Okay, that's me. We did the disclaimer. We've done CFPB, and we're now on to the Office for Older Americans. Okay, so we are a special population office within the CFPB's Consumer Education and Engagement Division. We lead, we envision, and we work collaboratively with other federal agencies often to lead initiatives to help protect older people from financial harm. We create lots of tools and resources, which I will go over several of them today, assuming we have time. And all of our resources are free, meaning they are owned by American taxpayers, by American citizens. So you can order them in print, in bulk, free of charge. You can go to consumerfinance.gov/older Americans and fish around for order. Anything you see that says order in bulk. So they are made available to you for free. You can also download them. You can use the content any way you wish. If you have newsletters or other ways to distribute information, you're welcome to cut and paste. If you make any changes to our information, to our copy, we just ask that you don't use our branding. But you're welcome to take anything that we share and use it to the advantage of older people, family caregivers, the community at large. Okay, and so let's jump right into this new area of major concern. As you know, well, let me just back up while you're looking at this and just say that this program is actually Money Smart for Older Adults. However, I have adapted it, or we have adapted it, to put a focus on the COVID-19 frauds and scams and some resources for you. And Most of what I'm about to show you is actually copied from our blog. So if you go to consumerfinance.gov and scroll through our blogs, you will find under older Americans, you'll find most of this content. And there, I have to say, I was particularly pleased when I went through it myself when it was first going through clearance and then available, and found that there are lots of wonderful links in here. It's kind of a deeply nested set of blogs where there's, you know, the content, but then there's also just these back doors into areas where there are some exercises you can do with your partner about, are you financially ready for a disaster? There's all kinds of good stuff in here. So that's what I'm about to show you, and then we'll finish up with some resources. So you probably are aware, even in your very dynamic housing environments, that social isolation is already an issue for older people, and it certainly can lead to lots of issues. And one of those issues, which may not be social isolation, it could be isolation by a scammer, somebody in their life or a family member who tries to get an older person's money. And even if they're showing up for meals or they are engaged in activities, isolation can be as subtle and as sinister as telling people to keep a secret about a deal they've been offered, or about a paperwork that they're signing, or whatever it is, whatever the scammer is trying to do. Scammers know that if they can isolate an older person from those that would intervene, they've got it made. And so even though your folks are living in congregate housing, they still could be being isolated in the privacy of their own space, or with their own phones or their mail or otherwise. So we have been very concerned about what we're hearing about from Adult Protective Services, from law enforcement, anecdotally from our partners. Just in my own community here in North Carolina, I belong to a social media neighborhood site that keeps neighbors in contact with each other. And I've noticed just in the last few months, there have been lots of concerns posted about older people who have been discharged from the hospital to avoid getting the virus, but are now home alone. They don't have the ability to get what they need, et cetera. So we're seeing this coming out in a lot of different ways. There's no sort of cookie cutter to how isolation is affecting older people in these unprecedented times. So just because someone lives in your congregate area, building does not necessarily mean somebody isn't figuring out how to isolate them in some way. Okay, and scammers often target older people because they have more assets, even if they're low income or moderate income, or many times think they have no money. Any amount is worth some scammer's effort to try to get a hold of. Sometimes it can be a caregiver or someone who just comes in and slips $10 out of an older person's wallet because they have access, and they're supposedly helping them, or perhaps helping them in other ways, but they're opportunists, and they see a small amount of money. So older people are at a much higher risk in general for serious illness. They may be isolating themselves or be isolated, and they also may be vulnerable to other people around them. So just lots to think about here. Family members need to be aware of common types of scams. If you have family members who are paying the bills, who are acting as a fiduciary for your residents, you may want to share information with them, like our Money Smart for Older Adults resource guide. We also have Managing Someone Else's Money Guide. If you have the opportunity to share information with them, because they too, the fiduciaries are often targets of scammers who are trying to get at the older person's money through the fiduciary, and that can have very devastating effects. And also, sometimes the fiduciaries are the culprits. And so by making them aware that you're watching, that scams are a problem, and you're keeping them, it may give them pause if they think this would be good timing to help themselves to grandma's money. And as you can see, there's all these links in here. I hope you can see the links. And I hope I didn't confirm with Janelle yet whether you will receive the PowerPoint. I hope you will, because these links are all live and they will take you information.
Yes,
yes,
they will.
Wonderful.
They will after the sessions.
Excellent. So just know that no matter what anybody says anywhere, Social Security will not suspend or decrease benefits due to the pandemic. And there are lots of scams around Social Security benefits. I can't even, at this point, I'm just going to scratch the surface here and just raise your awareness and get you a few red flags, because if you hear anything about the decrease in benefits or any sorts of changes in how things are done, and you're not hearing it directly from Social Security or from a trusted federal source, and you even have to check your trusted federal sources, because we are being spoofed all over the place. I was hearing the other day about the CFPB logo being used by scammers, and this is a big problem. It's always been a problem, but scammers follow the headlines. And this is the headline right now. And so they, are not as successful at the moment with some of the other scams that they've been able to perpetrate, where they get an older person to go out. Older people aren't going out as much. They are adjusting themselves to find easy pickings and to use fear, and under the cover of a government cloak, to incite older people to separate from their money. So I think you don't need me to read these slides to you. You can get it. But if you have any questions about this, you can call Social Security directly. If you see any scams, you can report them to the Office of Inspector General. There's a possibility they may even respond to an email if you send them an email with a question, because I know they are very concerned and they are working as hard as they can to put a plug in all of these leaks. We have lots of resources, tips for financial caregivers, which I mentioned earlier. We have online and mobile banking tips. We're hearing, we don't have hard data yet. It's really too soon to get studies up and running and to shift money to get studies going. But we are hearing that older people are increasingly starting to use online and mobile banking applications, because, and I actually read something today, it was an industry study, I will not cite it, but it basically said that they are expecting a 25% decrease, and that's just right off the top of their heads, in people actually returning to branches to do their banking. And I'm assuming that's 25% of the general population. And if you look at the numbers around how much of that population is older adults, that's quite a few. So older people are looking for, I know that they're interested in online and mobile banking safety. That might be something that you could offer as a training or something from one of your partner institutions or a trusted source, of course. But online and mobile banking tips, we have quite a few. And again, you print these off and slide them under folks' doors, whatever works for you. And then planning your finances for an uncertain future. We have tips to help you talk to your spouse and other family members about putting plans in place if you become unable to manage your finances in uncertain times. So let me reframe that to say, I'm from California also, and I have a long history of work in disaster preparedness as a volunteer firefighter, as a community member, as a homeowners emergency action response team member and trainer. And we have always thought of disaster preparedness as earthquakes in California and fires, and then, getting to the East Coast and whatnot, weather incidents, and then, flooding and whatnot. Like, it's usually natural disasters. And then sometimes it's things like, hazardous materials, chemical spills, we have all kinds of stuff going on in the world. But I have to admit, personally, I had not really seriously considered pandemic as being a reason to deploy disaster preparedness around finances, and now we know that it is. So we have taken that into consideration, and we have some tips around that, and it's something that you can think about. Like, we've also thought of disaster preparedness or planning for an uncertain future as preparing for diminished capacity. Like, what if you were unable for any reason to be able to manage your finances, whether you had a health crisis or a fall, or, God forbid, a more serious situation like diminished mental capacity that was a more permanent situation. And most people just really don't want to deal with this stuff. But now we know that it can be anything, and this is a very sad example of why we need to be ready, because one of us could become ill, or one of us could be called away, or whatever the case is. I think I've made my point. But I'm sort of struck just personally at how important, how much more important this was than even I realized, having had the history I do with that area of emergency response. Charity scams, very, very big right now. There's a lot of Corona-related charity scams out there. You'll get this slide, so I'll move along so I don't take up too much of your time. So you know what a charity scam is, but now there are a ton of them around COVID. And of course, they'll take money from anyone they can get on the phone or any which way. But if they can find an older person who's a little lonely, or whose family member hasn't been in touch, or perhaps they're just super charming, they will get them on the phone and also frighten them. Frighten them into, not just charity scams, but other scams. But they often use fear or other tactics to emotionally move anyone, but particularly older people, into making, moving money into accounts. Actually, this is a person, we're talking here about person in need scam. I imagine most of you are familiar with the grandparent scam, where an imposter posing as a grandchild calls and says, I'm in trouble, or, I need help, I'm in jail, I've had an accident. Any host of or number of stories can be told. So I heard a spin, actually a nasty spin, that I say we loosely, we are looking into, we are not investigating it, but we're looking into it in my office, where someone here in North Carolina received a call from someone claiming it was a grandparent scam. I understand, I don't know the exact details of the story, the exact fact pattern, but somehow they got this older person to take withdrawals, large amounts of withdrawals out, and then drive around to an automatic teller machine in a large financial institution, a national financial institution, and put that money back in, and it went to the scammer, and it's gone. And it turns out it's something like $9,000. So this is one that is continuing. It's possible that it's in an uptick because of COVID. I think there's probably a lot of COVID stories as reasons why this money is needed. I think that's also true around the romance scams. They're using COVID as the reason why for the urgency. So this is a highly successful type of a scam. Person in need is one description for it. Grandparent is a type, but there are also imposter scams, because these folks are imposters, and there's government imposters and different types of imposters who tell these stories to cause, you'll see in the second bullet point, to cause panic and get the older person to take action by providing account information over the phone, or arranging an online transfer, or whatever the case may be. So we always remember from our fire drills as kids, don't panic. Panic kills. Take a deep breath, get the facts. Don't ever be rushed into a financial deal. And that's what I tell older people. And if they tell you to keep it a secret, like don't tell anybody, there's something wrong. You should never keep have to keep a emergency financial situation a secret, or any sort of financial situation. It's your money. It's your choice who you talk to about it. Don't ever let anybody push you. That's my message to older people. Hopefully you can help deliver. So here's just sort of another tip about who handles the finances in your family. If you're the money manager in your household, or your resident is the money manager for their family or their partner, the question again, what happens if you are unable to manage the budget and bills without, or they are unable to manage without your guidance if something happens to you? So in this blog, there are 6 questions that you and your spouse can answer to show how prepared each of you is to handle the finances. And your response gives you a checklist of information in case one of you doesn't pass the test. Sounds like a nice Friday night date theme. I'm not kidding. Okay. And then other resources, we have one, Protecting Yourself Financially. These are specifically for older adults, and it's resources to protect yourself during the COVID-19 pandemic. So you can click on these, download them, print them off, and share them in newsletters, slide them under doors, drop them at lunch tables, wherever you have older people. Fraud awareness is always, however you can do that nowadays. I realize that we can't fill rooms with older people and share information unless you can do it with proper social distancing, etc. But I don't know. I've been hearing that older people are increasingly getting on sort of Zoom functions to see their grandkids. I guess part of the upside of the crisis is that we're all getting a little more tech savvy in many ways, like we were testing ourselves with right here today. So I have heard that groups like AARP and others are hosting sort of weekly or every other weekly check-ins or webinars on Zoom or some other platform. I'm not promoting Zoom, by the way. That's why we're on WebEx today, because we're not allowed to use Zoom in the federal government. But anyway, there are ways and innovations are starting to take hold on how to decrease isolation. If the older people in your building have a bubble of folks that they are safe with, perhaps somebody in that bubble can help to get them connected to a webinar or a production or something that you put on or you arrange for. You might talk also, we talk a lot about networking and networks with area agencies on aging and their elder abuse task forces. You might check to see if any of your local elder abuse task forces, coalitions, FAST teams, multidisciplinary teams, and a FAST means financial abuse specialist team, by the way. If any of their organized elder abuse prevention programs are doing anything in terms of innovating around fraud prevention. And you might be able to tap into something like that should it exist. I know everybody's scrambling just to deal with getting PPE and being able to respond to scams, let alone doing the prevention stuff. But anyway, we do the best we can. Just avoiding scams while you're finding help during quarantine, watching out if your loved one needs help with errands. That's actually kind of a big deal these days. There's a lot of people offering to help, and their kind of help is not the kind of help you want. And I actually have seen this also on our on that neighborhood network application I mentioned to you that I am engaged with. I've seen a lot of people offering to help older people with errands and bring them food and whatnot. And I think initially, oh, how lovely, that's great. And then I think, that could be dangerous. And so I have sort of intervened a little bit around that. So if you see strangers coming in and out, or people who are, I'm sure you're already very attuned to this, but just be alert, and of course alert in your own families and with your own older family members elsewhere in the world, I will say. Okay. Next, you can ignore the reverse mortgage disaster guide unless someone else in your family perhaps has or needs a reverse mortgage. This is a really great resource. And there is a quiz. We have a quiz in there about whether you're ready to manage your household finances. I don't know if the quiz, honestly, is the same as the 6 questions. I think they might be 2 different things. I apologize that I'm not 100% clear on that at this moment, but it's more stuff to look at and share around. And I'm pretty sure it has nothing to do with reverse mortgages, but that's there if you need it as well. Virtual valuables. We have tips on how to create a plan for your digital assets. Of course, planning for diminished capacity is important at all times. It does not matter whether COVID is happening or not. We all need to be thinking about that, our financial future. And we have a great, what we call a one-pager. It's not a big manual or a guide. It's just a double-sided page that talks about planning for your financial future, getting documents in order, and watching out for exploitation. And we produce that jointly with the SEC, the Securities Exchange Commission. That was an interagency effort. Hold on, I'm going to try to make my phone not make any more funny noises. There we go. And so now you all know, I think, except for perhaps those of you that are new, about our Money Smart for Older Adults program. This is the sort of a special edition of it. But this is an awareness program. We have printed materials. We have an instructor guide. We have a resource guide for consumers or older consumers. And we also have a PowerPoint that looks just like this, except it's pure Money Smart. You're going to have this also, which is kind of hot off the press, actually. But all of the resource guides are free of charge. They're about 100 pages, but they're in 14-point font. And it's a large selection of different types of frauds and scams that are grouped into areas, common frauds and scams that target homeowners, and scams that target elder veterans, and scams that target, preparing for disasters and all. There's and a bunch of other good stuff. There's quizzes in there. There's some just several activities to make it interactive. And the same with the instructor guide. It has the PowerPoint on one side, it has the script on the left, and it has all kinds of tips and resources for how to give a presentation. So if you have a way to broadcast or share information amongst your residents, this is a great set of materials. And again, you can order it in you can download everything in PowerPoint download everything in PDF and the PowerPoint slides, but you are welcome to cut and paste. You can convert them to Word, cut and paste, and share any of that information around in small bites, because the entire curriculum is 3 hours worth of presentation time. So you could divide it up into chunks and share a scam a week or a scam, a regular scam and a COVID scam at one time. And then we have fraud prevention placemats. I've been saying lately that, these are great in congregate meal sites, but I think we're not congregating that much these days. So, but that doesn't mean people don't have, sit down and eat a meal in their home, in their apartment. So you can still order the placemats and you can still distribute them. And many of them have games and sort of activities on them. They're very simple. They're on, I think we have about 15 or 16 of them now. And they're also, actually, most of our materials are also available in Spanish. But what I say with the fraud prevention placemats is they do not have to have a meal on top of them. They could have a plant on top of them, or they could have, it could just be on the table. They could just be delivered and used on a countertop where your coffee service is. Be creative. But no, they do not have to be served with meals, is my point. I mentioned the managing someone else's money guides, help for financial caregivers handling finances. These are for fiduciaries. We often refer to them as lay fiduciaries, not professional money managers, although we find professional money managers do appreciate these materials to share with family members because it describes what they do. But there are 4 different types of guides. One is for a person who is a fiduciary with a power of attorney. They have an authority to pay bills and to manage the finances of a person. It does not have to be an older person. It can be a person with a disability or a person who assigns that authority, that fiduciary authority over. Fiduciary authorities can be broad or they can be very narrow. But the Managing Someone Else's Money Guide talks about how to be a fiduciary for an older person when you need to be bill paying. We also have another guide that is for representative payees for government benefits, which are veterans benefits and Social Security rep payees. So the power of attorney, POA, and the rep payee roles often run hand in hand. If you have one, you may well have the other. It's actually quite likely, not always, but likely. So those two run hand in hand. And then we also have one for guardians and conservators who are court appointed. And we also have a guide, a Managing Someone Else's Money Guide for there's one more, trustees of living trusts. That's right. And so these would be great to share with your older residents, because even if they are totally financially independent and paying their own bills, there may come a point that they aren't, or they are not going to be, and they will need help. And when they go to assign these roles to someone, they need to choose who they assign these responsibilities to very carefully, because oftentimes they make poor decisions. Not always. Many good decisions are made out there. But we do see one of the major vulnerabilities and instances of financial exploitation as being caused by fiduciaries, perpetrated by fiduciaries, persons who are put in charge of an older person's money. And the older person may not realize the scope of authority they have provided, or they may choose the person to represent them, to be their fiduciary by tradition. In my family, I'll speak for, it was sort of widely understood that the oldest boy was automatically in charge, and that is not always a good basis for making that decision. The oldest boy in some families could have problems with managing money, may have problems with drugs or alcohol or gambling, or perhaps someone else is a better choice, someone else in the family, or perhaps an independent person is a better choice to be a fiduciary, to avoid conflict in a family when the kids don't trust each other or have turf issues around mom's money. So guides are great for the fiduciary to help them understand the rules of the road and what's expected of them. But I say they are also really great for older people to understand what those roles are and what's involved, and why they should have a power of attorney and take care of all this business before the court gets involved and has to appoint somebody for them, because that's a very complicated, expensive, and public process. So the Protecting Residents from Financial Exploitation is just another guide we have. It may provide you with some information since you're running houses. Obviously, you are not nursing facility staff or assisted livings, but there may be some nuggets of information in there. And of course, I always fall back on, you may have a family member that is in assisted living or in a nursing facility, and you could do the administrator a big favor by dropping off a copy if you felt so inclined. So I just jumped on my phone and was delighted to see that the CFPB at 12:49, just before we started, issued a joint blog, I believe, with the Social Security Administration. And this is an example of things that you can get if you sign up for our mailing list on the CFPB Older Americans page. You can get alerts like this that you can share if you have an email thing, or if you want to print them out, or whatever it is. But this is a message our colleagues at Social Security Administration asked us to pass along. And it says, while the agencies are not providing service or walk-in to visitors due to COVID-19, they remain committed. They want us to let you know that they are ready and able to help by phone with most Social Security matters. So just know that even though you can't walk into the offices, they have beefed up their telephone response process. They have lots of online resources available, and so just FYI. But that also gave me an opportunity to highlight that we have at consumerfinance.gov/older Americans, or you can go on the homepage to practitioners and go into older Americans or older adults, and you will find opportunities to sign up and receive the occasional alert. We don't send many, but we send them probably maybe once, twice a month at the most. Okay, so carrying on here. So towards the end, I'm let's see, I have about a dozen slides left. So I should get through those reasonably quickly. And then what we'll do is we'll open up for questions, and also, and something else that you might want to think about now while we're getting to that point is if you have any sort of stories you want to share, like brief stories, not 10-minute stories, but like snapshot stories of any sort of, if you're hearing about any particular frauds and scams that have taken place, whether it's in your residences or not, that are related to COVID, or anything else that you've seen uptick. And if you have any innovations to share about how you are reducing isolation or how you folks are coping with the crisis. So with that, I will just move on. You've probably already read the slide, but we are hearing about lots of scams. Again, I said the scammers follow the headlines. So there's lots of scams related to vaccines and test kits and cures and treatments and air filters. Oh my goodness gracious. Even I have received numerous calls about air filtration systems. So the air filter systems are big, and also the cures. And so just be aware and spread the word about this. Obviously, there is no vaccine and no cure. So we know these are automatically scams if those are the claims they're making. Okay.
And I just wanted to mention, unless you're going to mention it afterwards, I understand now there's a scam where they text you about contact tracing and to get people's account information or credit card or something.
Yes, that is true, and it isn't in here because it's fairly new, and this PowerPoint was cleared a little bit over a month ago. So, yes, the contact tracing is a new scam, and then all kinds of testing stuff also. Not just kits, but getting money for testing and what a bulk testing for you and your family, and oh my goodness. They'll think of anything and everything. But yes, thank you for mentioning that about the contact tracing, because basically the way I look at this, as I've always looked at it, is that when someone calls you or calls your older resident and offers a service, I basically look at those sorts of approaches as to be sort of unkind. I actually like vultures, but it's vulturous, it's predatory. They may be legit, but in these cases, absolutely not. But sometimes people selling services on the phone are legit. They may be unscrupulous, they may be annoying, and they may be legit. But as far as I'm concerned, it's always a torpedo headed at you, and it's not a good way to do business. And in the 20 years I've been talking to seniors about preventing or avoiding frauds and scams, I've always said, don't do business with somebody who calls you. You make the telephone call to a licensed, reputable community entity with a footprint, a building and an alliance with the Rotary Club or whatever, like somebody you've vetted and that you have friends and family or whomever who have used the service and can vouch for them. Because all of these are what we call the sort of incomings. There's strangers on the other end of the line. You don't know who they are. and there's a huge risk of accepting their pitch. So that's all I'm going to say about that. Okay.
And let's throw in the contact tracers will contact people. However, they do not charge for services. That is the key. The scam ones will be asking for a payment in some way.
Thank you for that clarification.
Real ones don't. They're being paid by your city or state.
Right. And that, yes. And thank you for that very important distinction. It's the request for money that is the red flag, or the request for personal account information. That's the red flag. No, they say that they are a government agency that is not Department of Health and Human Services related, but it is the CFPB about your bank account. No, we don't call anybody. IRS does not call anybody to collect overdue taxes. You have to verify. People have to verify. But yes, Janelle, thank you for the distinction. And of course, we're all treading in new waters here. Yes, of course, you might get a call about contact tracing, but you will want to ask the individual, how can they verify the validity of the call? How do they go about verifying? And I'm honestly not sure, but everybody must verify. But if they ask for money to do whatever they're saying on the phone, definitely not a good thing going on there. Okay, so we are working, as we are today, continuously. I'm going to be taking back the contact tracing info to update our information. It's a rapidly evolving situation. We publish all sorts of materials on our website. Some of it goes out in blogs. There is a COVID-19 resource page, which has all kinds of stuff for people of all ages. It's not just older adults, but check it out. It's pretty chock-a-block, and it'll take you to other resources such as Social Security or the Administration for Community Living, which is where the Administration for Aging is, or to any other number of government agencies that provide trusted source content. We have a Facebook page. We post all kinds of stuff on there. We do Twitter from time to time. We have a channel on YouTube with all kinds of information. And actually, you would find some Money Smart for Older Adult presentations if you wanted to see or hear one in action. We have lots of tips for older consumers on all kinds of information. So again, if you don't want to slam people with COVID information week after week after week, you can deal in a little document about medical debt, or the planning for diminished capacity, or info about co-signing student loans. Find that weekly sort of information, if you can do it, is kind of a nice cadence, with the occasional alert if something comes up, like contact tracing scams or something new. And I mean, I don't know. I guess I'm sort of a scam junkie by profession, but I think that it's if there's a sort of a rhythm to receiving information and it's expected and it's appreciated, then people look forward to it, and they'll look to it and hopefully share it around. And you can always put a sticky note that says, share this, talk about this, tell your friends. And here's a quickie on the managing someone else's money guides. They're now finally in 4 different colors, but there's the list. And as I said, available in English and Spanish. We have, sorry, I'm losing my clicker here. The placemats, lots of handouts, activity sheets, just tons and tons of good stuff. Originally, as I mentioned, to be used by meal programs, the placemats, but you can use them for anything now. And we do know that a lot of faith-based organizations, financial institutions, and other groups are now using them in a variety of ways. And then there are some companion resources that go with the placemats, if you're interested. I haven't actually thought about how those resources work in these times when we are social distancing, and whether whether those activities work, but they might be able to be adapted as an activity in your residence. Here's a look at the placemats themselves. And they are in lots of colors and lots of different topics now. And I think we're getting close to nearly 3 million of them in distribution. And here are the one-pager guides that are just, they're actually, they say they're one-pagers, but they're 16 by 20, or I think it's a 16 by 20. So they fold over to 8.5 by 11 or thereabouts. And that way you have basically 4 sides, but they are not jam-packed with information. But these, this one, Know Your Financial Advisor, the one in the middle here, is very important because for people who are considering getting a financial advisor or who have a financial advisor, there's a nice little checklist in there to make sure that you know who your financial advisor is and you can check them out. And those are good for people of all ages, including family caregivers, the people who are perhaps taking on fiduciary roles for an older person and need to engage a financial advisor. So again, thinking about your residents, but thinking also about their family members and engaging, and also think about yourself and your own family, etc. The next up, we'll just skip the reverse mortgage discussion guide. I probably should have pulled that out of here today, but now that I think about it, it might have been some form of divine intervention because there could be somebody in your family or in your neighborhood who needs to know more about these products, which don't work for folks unless you own your own home. And they can be very, they use very deceptive marketing tactics and sometimes high pressure tactics to sell them. But the fact of the matter is that they are a legitimate product if they are applied properly to the person's financial situation. We have a whole module on planning for retirement. It's an interactive tool online. It helps consumers navigate their Social Security claiming decision, like when to take your Social Security. It's easy to use on your mobile. Could be kind of fun if you're doing a how to use your mobile for, for financial empowerment session. You might consider adding this as something they could play around with safely. And we did work this up. We created it with Social Security Administration, again, available in both English and Spanish. Here is where you go to get the instructor guide and presentation slides for Money Smart for older adults. Now, just sort of recapping on that, this is a special edition of Money Smart for older adults, what you're seeing here today with the emphasis on COVID. The Money Smart for Older Adults program is common frauds and scams. They're in various categories. It's 3 hours worth of presentation material. However, the resource guide that you can order in bulk and have free of charge shipped to you is, with its 14-point font, so it's very easy to read. It's all plain language. It has lots of links and activities, etc. Anyway, that you can get directly from us. But if you want to get the instructor guide and the presentation slides, you go to the FDIC, our partner in producing it, fdic.gov/MoneySmart. And we also, something that we didn't intend to have happen, but somehow we ended up with a large number of instructor guides available to order as well, that they're actually in print. So if you order resource guides, if you order, say, 25 or 50 or 100 or however many you want, and you would like a couple of instructor guides, there's a box to tick for that now. Otherwise, you can go to the FDIC website and download it, and you can also only get the presentation slides at the FDIC website. Hope that's not confusing. If it is, shoot me an email or let Janelle know, and she can forward an email to me, and I can help clear it up. Let's see what time we have here. Okay. And then again, I mentioned earlier, consumerfinance.gov, our website for the Consumer Financial Protection Bureau, there is a section called Practitioner Resources, and then there's resources for older adults, and that's where you'll find everything. One thing that you will find right at the top of that section, Resources for Older Adults, is a new program that I was the lead developing and team lead for. Is called the Elder Fraud Prevention and Response Network Development Guide. There'll be a test on that later. I just call it the Network Development Guide. And this is a guide for folks like who are part of area agencies on aging, adult protective services, law enforcement, legal services, other sort of key stakeholders to help build or start an elder justice network, like a multidisciplinary team or a financial needs specialist team or some sort of coordinated, sustained group that works to prevent and respond to elder financial exploitation or elder abuse in general. And so the reason I bring this up is that you all are stakeholders. You all are extremely important intermediaries between the responders and preventers, and you being the service providers and preventers and responders also. You're a first line of defense. You are often the ones who see what's happening to people because you are there front and center in their lives, much the way we look at, even more so than the way we look at bankers and other folks that older people interact with. So if you are interested in joining a network or knowing if you have a local network, you can contact your local AAA, your area agency on aging, and find out if there's an elder abuse coalition, task force, multidisciplinary team. They have all different types of names, some sort of a coordinated group, and see if they are interested in accepting you as a member. Sometimes they are only doing like case review work and it's highly confidential, but sometimes they are quite open to various community members and stakeholders because they may have subcommittees on community education or legislative activities or increasing response and coordination of response, or it's through creating local protocols and the like, or they may be beefing up victim resources and legal assistance for older people. No matter what the case may be, it's a good place for you to network and to find people that you can talk to if you have a question, or you may find speakers that you can call into your facility to come and give presentations live, or you may find out, as I mentioned earlier, what sorts of innovations are going on to reach people who are at risk and who need to not go out and be amongst each other or whatnot, depending upon what areas you're living in and what's happening. But I just wanted to mention that this network guide is kind of an interesting and very malleable online resource for sort of like community development, for network development, and perhaps you want to create a network of similar folks like yourselves. So have a look. It may have some items of interest. There are 23 web pages that are not laden with material, but there are also 10 tools, and some of those tools you may be able to use to apply to event planning. There's some checklists, and there's also something called a stakeholder spotlight that lists every kind of stakeholder we could think of that you might find in your community who has some reason to be concerned with or engaged with protecting or responding to older people and elder abuse or elder financial exploitation. And that list alone may be of interest to you. It includes bankers, it includes postal inspectors, it includes the long-term care ombudsman, it includes adult protective services. The list is long. And so just for your edification on who's who, you might just find that document to be helpful. But certainly if you are able to join a local network, a local multidisciplinary team or task force, coalition, etc., and be supportive, provide your location as perhaps somewhere where they can come to give a presentation, not the whole group and not unsafely, just as conditions allow. Just consider it, because all these resources are free and we all need each other. And networks help. They help to increase responsiveness. They help to increase coordination and collaboration. And they help to keep us all in the loop and connected and knowing what's available for ourselves to do our work and for older people to receive everything they can to keep them safe. So with that, I also want to acknowledge my esteemed colleague, Bill Benson. I'm looking forward to hearing your presentation and delighted that you're here today. We go back a very long ways, I think.
Unless anybody has questions, it's a lot of information, and I have a feeling like once they go and start looking again at the website, a lot of people have gotten all this, the guides in the past, but looking at it might actually bring up questions.
Sure.
So I guess that's the one problem with doing virtual training, give you physically all the materials in advance like that. We just didn't have the time or the money to mail all that out, get it and mail it out. So, but definitely look at all the, if you have not looked at these guides, they are really comprehensive. And as Jenefer said, you can put together a whole program using, downloading their slides, their program manual, that kind of stuff. And there's just so much information there and really important. And some of it is extremely important, especially the planning for diminished capacity during the pandemic, because we don't know who of us, our residents, or let's hope not ourselves, but our residents that, you know, there's certainly people that have mild cases of this COVID-19 if they get it, and let's hope nobody does. But, you know, people do end up in the hospital and then they come home and their rent and their bills are paid. So it's really important to prepare, and it's a good self-check right now to realize that if you haven't done it, anything can happen. But that we have this pandemic, that it's really important for our residents to know who's going to take care of that information.
Yeah.
Stuff like that.
And Janelle, I just realized that I sent over to both of you, I think, I believe it's a Word doc that has a list of our publications. I don't think it's an exhaustive list, but it's just a couple pages. And it has links to all the publications online. So you can actually browse, download them, look through them, and then, if you choose, order accordingly. But I did send over, and there's also a bunch of stuff on there for, you know, industry, for financial institutions and the like. There's some statistics under our suspicious activities report, report on SARS, which are filed by institutions. It might not be of interest to you, but it just might, and it might be stuff that you can share around with bankers in your family or the like. We see everybody as a portal to someone else. So, Eddie, there it is. Thank you. You put it up there. So yeah, that's the list of all our stuff, and that'll give you a little shortcut to help you find things quickly.
Well, I want to thank Jenefer. That was great information. I know those of you that have seen her before, she really is has a ton of information. So certainly, after looking at some of the guidebooks, if you have questions, contact her. And again, we will send out the PowerPoint. We'll send out that the list, the Word document I just showed you that Jenefer was talking about. Really want to thank her for taking the time